Hello and welcome to a special BriefingsDirect panel discussion coming to you in conjunction with the Open Group Conference on February 3 in San Francisco. I'm Dana Gardner, Principal Analyst at Interoperability Solutions, your host and moderator as we examine how the healthcare industry can benefit from improved and methodological information flow. Healthcare, like no other sector of the economy, exemplifies the challenges and the opportunity for improving how the various participants in a complex ecosystem interact. The Open Group, at its next North America conference, has made improved information flow across so-called boundaryless organizations the theme of its gathering of IT leaders, enterprise architects, and standards developers and implementers. Join us now as we explore what it takes to bring rigorous interactions, process efficiency, and governance to data and workflows that must extend across many healthcare participants with speed and dependability. Learn how improved cross-organization collaboration plays a huge part in helping to make healthcare more responsive, effective, safe, and cost-efficient. And also become acquainted with what the Open Group's new Healthcare Industry Forum is doing to improve the situation. With that, please join me in welcoming our guests. We're here with Larry Schmidt, the Chief Technologist at HP for the Americas Health and Life Sciences Industries, as well as the Chairman of the Open Group Healthcare Industry Forum. Welcome, Larry.
Thank you.
We're also here with Eric Stevens, an Oracle Enterprise Architect. Welcome, Eric.
Thank you, Dana.
Gentlemen, we have you both here because you're going to be at the Open Group Forum coming up very rapidly, early February in San Francisco. And we want to get into a little bit about this new healthcare forum. But before we get into the particulars of what we can do to help the healthcare situation, let's try to define a little bit better what's the state of affairs. So first to you, Larry, why is healthcare such a tough nut to crack when it comes to this information flow? Is there something unique about healthcare that we don't necessarily find in other vertical industries?
Well, I think what's unique about healthcare right now is that in order to really answer the question, we've got to go back to some of the challenges we're seeing in healthcare. We've really progressed in healthcare from a healthcare delivery model that was more based on acute care. That is, I get sick, I go to the doctor. To more of a managed care type of capability with the healthcare delivery, where a doctor at times is watching and trying to coach you and so on, to now where I think we've gotten to is that the individual is in charge of their own healthcare. And with that, the ecosystem around healthcare has not had the opportunity to focus the overall interactions based on the individual. So we see an awful lot of fragmentation occurring. There's many great standards that happen across the towers that exist within the ecosystem. But if you take the individual and place that individual in the center of this universe, the whole information model honestly changes. And then, of course, there's other things such as technology advances and personal biometric devices and things like that to come into play that allow us to be much more effective with information that can be captured for healthcare. And as a result of that, it's the change in my mind. It's the change of the focus to the individual that is really allowing us the opportunity to redefine how information should flow across the healthcare ecosystem.
So I guess it's interesting, Larry, that the individual is sort of at the center or hub of this ongoing moving ecosystem with many spokes, if you will. Is that a characterization, or is there no hub? And that's perhaps one of the challenges for this.
Well, I think that is what you said. The first was a good way to categorize it. The scenario of the individual taking more in charge of their health care or care of their health, I think would be a better way to think of it, is a way to see both improvements in the information flow as well as making improvements in the overall cost of healthcare going forward, And as I offered earlier, because the ecosystem it had pretty much been focused around the doctor's visit to, or the doctor's work with an individual as opposed to the individual's work with the doctor, we see a tremendous opportunity in making advancements in the communications models that can occur across healthcare.
Uh-huh. And Larry, is this specific to the United States or North America, or is this global in nature, or is it very much a mixed bag, market to market, as to how the challenges have mounted?
I think in any country, literally across the world, the individual being the focus of the ecosystem, is goes across the boundaries of countries. And so, of course, the Open Group is responsible and is a worldwide standards body. And as a result of that, I think it's a great match for us to be able to, focus the healthcare ecosystem to the individual and use the capabilities of the Open Group to be able to make advances in the communication models across all countries within that around healthcare.
Right. And I should point out for our audience that the views of our panelists today are theirs alone and not necessarily those of their employers. And I'd like to go to you now, Eric. Thinking about this from a technological point of view as a enterprise architect, we're now dealing with this hub and spoke, if you will, with the patient at the middle. And a lot of this really does have to do with information and data and workflow. But we've dealt with these things before in many instances in the enterprise and in IT. Is there anything particular about the technology that is difficult for the healthcare, or is this really more a function of the healthcare vertical and the technology is really ready to step up to the plate?
Well, Dana, I think the technology is there and it is ready to step up to the plate. I think that when we look at other industries and the level, I'll start with transparency of the information. Let's pick a favorite poster child of Amazon. In terms of the detail that's available on my account, when I can look at past orders, when I can look up and see the cost of services, when I can track activity that's taking place, both from a purchase and a return standpoint, that level of visibility, as you were alluding to, it exists. The technology is there, if you will. It's a matter of applying it, and why it's not being applied in a rapid fashion in the healthcare industry. We could surmise a number of reasons why. I think, one of them is potentially around the cacophony of standards that exist and the lack of, let's say, a Rosetta Stone that links those standards together to maximum interoperability. I think the other challenge that exists is simply the focus in healthcare around the healthcare technology that's being used, the surgical instruments, the diagnostic tools and such. There's focus there and there's great innovation there, but when it comes to the plumbing of IT, oftentimes that will suffer.
So we have some hurdles on a number of fronts, but not necessarily the technology itself. This is a perfect case study, if you will, for this concept of the boundaryless information flow, which is really the main theme of the Open Group Conference coming up on February 3rd. So back to you, Larry. This boundarylessness, if you will, there's standards in place in other industries that help foster a supply chain ecosystem or a community of partners that work together. Is that what the Open Group is seeking? Are they going to take what they've done in other industries for standardization and apply it to healthcare, or do you perhaps need to start from scratch, that this is such a unique challenge that you can't simply retrofit other standardization activities? How do you approach something like healthcare from a standards perspective?
Well, I think the first thing we have to do is gain an appreciation for the stakeholders that interact across, and we're using the term ecosystem here. I think it's a great term to be reflective of the vast number of stakeholders that would exist across the healthcare ecosystem. The anywhere from the patient to the doctor to payer organizations for paying claims, to life sciences organizations for pharmaceuticals and things like that. There's so many places that stakeholders can interact seamlessly, and so being able to use the Open Group's assets to first understand what the ecosystem can be, and then secondly, using the Open Group's capabilities around things like security and TOGAF from an architecture methodology enablement and so on. Those assets are things that we can leverage going forward to allow us to be able to use the tools of the Open Group to make advances within the healthcare industry. And I do think though that it's a major challenge, but you can't you got to take it a step at a time, and the first step is going to be that definition of the ecosystem. Thanks, Dan.
Right. Now, I suppose there's no better place to go for teasing out what the issues are and what the right prioritization should be than to go to the actual participants. And the Open Group did just that last summer in Philadelphia at their earlier North America conference in the past 12 months. They had some 60 individuals representing primary stakeholders in healthcare in the same room, and they conducted some surveys. Larry, maybe you could provide us an overview of what they found and how that's been somewhat of a guide to how to proceed.
Well, what's really interesting about the work that we did in Philadelphia, and specifically what we wanted to do was present the concept of boundaryless information flow across the healthcare ecosystem. And so we did survey the team members that were part of the participants that were part of the conference itself. And one of the questions that we asked was about the healthcare quality of data as well as the efficiency and the effectiveness of data. And specifically, the polling questions, they were designed to gauge the state of healthcare data quality and effective information flow. And we understood that 86% of those participants felt very uncomfortable with the quality of healthcare information flows, and that 91% of the participants felt very uncomfortable with the efficiency of healthcare information flows. Now, in the discussion in Philadelphia, we talked about why isn't information flowing much more easily and freely within this ecosystem, and we discovered that a lot of the standards that currently exist within this ecosystem are very much tower oriented. That is, they only handle a portion of the ecosystem, and the interoperability across those standards is an area that needs to be focused on. But we do think, though, that because of us thinking that the individual should be placed in the center of the ecosystem, that there's also new ground that will come into play. And our Philadelphia participants actually confirmed that as we were working through our workshop. So, Dana, I think that was one of the big findings that we had in the Philadelphia conference.
Right. And just so our audience understands, the resulting work that's been going on for months now will culminate with the Healthcare Industry Forum being officially announced and open for business, so to speak, beginning with the San Francisco conference. So tell us a little bit about how the mission statement for the Healthcare Industry Forum was influenced by your survey, and if there's other information, perhaps a white paper or other collateral out there that people can look to either learn more about this or maybe even take part in it.
Well, we presented first a vision statement around boundaryless information flow, and it read, and I'll go ahead and just offer that to the team here. Boundaryless information flow of healthcare data is enabled throughout a complete healthcare ecosystem through standardization of both vocabulary and messaging that is understood by all participants within the system, resulting in higher quality outcomes, streamlined business processes, reduction of fraud, and innovation enablement. And when we presented that in the conference, I mean, there was a big consensus in the participants around making sure that around that statement and buy-in to that. We want that as our vision for a healthcare forum to actually occur. Mm-hmm. Since then, of course, we're published this white paper that is the findings of the Philadelphia conference. We are working towards the production of a treatise, which is really the study of the problem domain that we believe we can be successful in, as well as we can make a major impact in around, again, this individual communication flow and enabling individuals to be able to be in charge more of their health care. And so our mission will be to provide the means to enable boundaryless information flow across the ecosystem. And what we're trying to do is make sure that we work in concert with other standards bodies, recognize the great work that is happening in our standards bodies around, as I mentioned earlier, this tower concept that we believe is a boundary within the ecosystem, and hopefully get to a point where we are able to collaborate both with those standards bodies as well as work within our own means to come up with additional standards that allows us to make this communication flow, as we see, seamless or boundaryless.
Right. And Eric Stevens, back to you with the enterprise architect questions. Of course, it's important to solve the Tower of Babel issues around taxonomy and definitions and vocabulary, but I suppose there's also a methodology issue. Frameworks have worked quite well in enterprise architecture in other verticals and in the IT organizations in enterprises. Is there something from your vantage point as an enterprise architect that needs to be included in this vision, perhaps looking to the next steps after you've gotten some of the taxonomy and definitions worked out?
Dana, in terms of working through the taxonomies and such, I view that as a part of, as an enterprise architect, I view it as part of a larger activity around going through a process like the TOGAF methodology, its architecture development methodology, and by doing so, using a tailored version of that, we'll get to that taxonomy definition and the alignment of standards and such, but there's also the addressing an alignment of business processes and other application components that comes into play, and that's going to drive us towards improving the viscosity of the information that's moving both within an enterprise and outside of the enterprise, because we see in the healthcare landscape and in other industries that there are a lot of players that are coming to the table and need to interact, especially if you're talking about a complex episode of care. You may have 2, 3, 4 different organizations in play. You have labs, you're going to have, the doctors, you're going to have specialized centers and such, and all that requires information flow. So coming back to the methodology, I think it's bringing to bear an architecture methodology like provided in TOGAF is going to aid individuals in getting a broad picture and also the detailed picture of what needs to be done in order to achieve this goal of the boundaryless information flow. Excuse me.
And I suppose, gentlemen, we should also recognize that we're going about this in a larger context of change in the IT and business landscapes. We're seeing many more mobile devices. We're probably going to see patients accessing more information that we've been discussing through some sort of a mobile device, which is good news because more and more patients and their providers can access information regardless of where they are. So mobility, I think, is a fairly important accelerant to some of this. And of course, big data, the ability to take reams and reams of information and deal with it rapidly, analyze it in near real time, and then scale accordingly for cost issues is also another big thing. So let's just quickly step aside from the forum activities and look at how the larger context of change is perhaps fortuitously now timed for what we'd like to do in terms of transformation around healthcare. Let me first direct that to you, Larry. How important are things like mobile and big data to making significant progress in the issues facing healthcare?
Well, it's interesting because when you first started with the mobility devices, I actually actually think that the mobile devices become what I'll call a personal integration server, helping the individual who wants to take charge of their health care or care of their health, to give them the opportunity to be able to capture information using other devices such as biometric devices, blood pressure monitors, and things like that, and have that actually sent to or captured on a mobile device and placed in a repository someplace to allow either a physician or others or even that individual to look at trending over time. And so mobile devices from a standpoint of being able to gather data is a great technology enabler that has come of age now that allows us the opportunity to help streamline that information gathering that is necessary to provide the right diagnosis, working with your health coach or your provider and so on. And then, of course, that has the possibility at the individual level of producing a lot of data. And it could be massive amount of data depending on how the data is actually gathered. And so big data and analytics from a standpoint of even at the individual level, being able to decipher or to understand, trending and things that are happening to the individual over time outside of the doctor's office is something I think will really enable improvements in healthcare. And all that, of course, is fueled by the Internet of Things and technology advances such as IPv6 to allow us to have the ability to use devices like this across a network and actually keep them identified and so on. So those two technologies and that we see in IT trends, great help to the advancing of healthcare and of course the possibility of enabling boundaryless information flow.
Right. Eric Stevens, want to weigh in as well on where these new advances in IT can play a huge role if those standards and if that framework approach methodologies are in place.
I think Larry really hit the points well, and I was starting to think about the new terminology, the Internet of Things or machine to machine, where mobile devices could end up being the size of a fingernail at some point. And do we get to the point where there's real-time monitoring of critical patients, going back through their other mobile devices and into a doctor's office or something? The ability to do the virtual office visit, if you will. I mean, how much equipment would you need in a home, for example, to go through and do routine checkups and so on children and such? And so I think that one of the key success factors that is going to have to be addressed is interoperability. Back when we were all starting to cut our teeth on the internet, one of the things that was fascinating to me is that you have a handful of standards, and all these vendors are conforming to them, such that you don't have to think about plugging in a laptop to a network or accessing a website. All that's driven by standardization. And as one of the things that we can do in the forum is start to drive some of that standardization so that we have these devices working together easily, and it provides the necessary medical professionals the information they need so they can make more timely decisions. It's getting the right information to the right decision maker at the right time. And that in turn drives better health outcomes, and it's going to, we hope, drive down the overall cost profile of healthcare, specifically here in the United States.
And I should think makes for a high incentive to work on these issues of standardization and taxonomy and definitions and methodologies so that you can take advantage of these great technologies and the scale and efficiency they afford. So, getting back to the conference, I understand that the healthcare forum, healthcare industry forum, is going to be announced. There's going to be a charter, a steering committee program, definitions and treatise in the works. So quite a bit now kicking off. I'd like to hear from you two, Larry and Eric, what you'll specifically be presenting at the conference in San Francisco in just a matter of a week or two. So, Larry, what's on the agenda for your presentations at the conference?
So actually, Eric and I are doing a joint presentation, and we're going to talk about some of the challenges that we think we can see that is ahead of us as a result of trying to enable our vision around a boundaryless information flow, specifically around healthcare. The culture of being able to produce standards in a industry like this is going to be a major challenge to us. There's a lot of individualization that occurs across this industry, and so having people come together and recognize that there's going to be different views, different points of views, and coming into a more of a consensus on how information should flow, specifically in healthcare. Although I think any of the forums go through this cultural change that will occur. So we're going to talk about that at the beginning of the conference, and as part of how we're planning to address those challenges as part of the industry forum itself. And then other meetings will occur that allow us to continue on with some of the work that we've been doing around a treatise and other actions that will help us get started down the path of understanding the ecosystem and so on. So those are the things that I think we'll be addressing at this specific conference going forward.
I see. Eric, anything to add to that? I didn't realize you were both doing this as a joint presentation.
Yes, and thanks to Larry for allowing me to participate. And one of the areas I'll be focusing on, you were alluding to this earlier, Dana, is really around the information architecture. As an enterprise architect, I look at things in terms of the business, the application, information, technology architectures, and I think that when we talk about boundaryless information flow, my remarks and contributions will really focus in on around the information architecture, and specifically around what an ecosystem of an information architecture looks like at a generic level, but also the need and importance of integration, and perhaps touch a little bit on the standards, integrate that in with Larry's talks.
Mm-hmm. And Dana, I just wanted to add as well that other work that we'll be doing there at the conference, we have invited some of the healthcare organizations that exist in that area of the country, the San Francisco and so on, to come in on Tuesday, and we plan to present the findings of the paper and the work that we did in the Philadelphia conference, and get the next set of opinions in refining both the observations as well as some of the direction that we plan to take with the healthcare forum. Obviously, we've shared here some of the thoughts of where we believe we're moving with the healthcare forum going forward. But as the forum continues to form, some of the direction of it will morph based on the participants. And of course, I think based on some of the things that we see happening with industry and so on. So really exciting time. And I'm actually very much looking forward to presenting the findings of the Philadelphia conference, and then getting, as I said, that next set of feedback and starting the discussion as to how we can make change going towards that vision, if you will, of boundaryless information flow. Thanks.
Yeah. I should also point out that it's not too late for our listeners and readers to participate themselves in this conference. If you're in the San Francisco area, you're able to get there and partake, but there's also going to be online activities. There'll be some of the presentations delivered online, and there'll be Twitter feeds. So if you can't make it to San Francisco on February 3, do be aware that the Open Group Conference will be available in several different ways online, and then there'll be materials available after the fact to access on demand. And of course, if you're interested in taking more activity under your wing with the forum itself, there'll be information on the Open Group website as to how to get involved. Okay, before we sign off, I want to get a sense of what the stakes are here. It seems to me that if you do this well, you do this correctly, you get alignment across these different participants, that patient being at the hub of the wheel of the ecosystem. Tremendous opportunity here for improvement, not only in patient care and outcomes, but costs, efficiency, and process innovation. So first to you, Larry, if we do this right, what can we expect?
Well, I think there's several things to expect. Number one, I believe that the overall population health or the health of the population will improve because individuals are more knowledgeable of their individualized health care, and doctors have the necessary information based on observations in place as opposed to observations or gained through discussion and or interview of the patient. We're actually able to see a better profile of what the individual is doing throughout their life and throughout their days that can provide doctors the opportunity to be able to make better diagnosis. And better diagnosis with better information, Eric said it earlier, the right information at the right time to the right person gives the whole ecosystem the opportunity to respond more efficiently and effectively, both at the individual level and I think in the population abroad across. Mm-hmm. And I think that actually plays well with any healthcare system, literally around the world. So very exciting times here. Thanks.
Right. And Eric, what's your perspective on some of the paybacks, metrics of success, if you will, when some of the fruits of this standardization begin to impact the overall healthcare system?
At the risk of oversimplifying and repeating some of the things that Larry said, it comes down to cost and outcomes are the two main things. I think that what's in my mind right now, I think I look at these very scary graphs about the cost of healthcare in the United States, and it's hovering in the 17 to 18% of GDP, which is, if I recall correctly, at least 5 full percentage points larger than other economically developed countries in the world. We start in the trend on individual premiums and such. It continues to tick upward, and anything that we can do to drive that cost down, I think is going to be very beneficial. And this goes right back to patient centricity, goes right back to their pocketbook, and I think the outcomes as well. There are a myriad of diseases and such that we're dealing with in this country, and I think more information, more education is going to help drive a healthier population, which in turn drives down the costs, such that the expenditures that are being spent are on the innovation. You leave room for innovation. You leave room for new advances in medical technology and such to treat diseases going forward. So again, back to its cost and outcomes.
Well, very good. I'm afraid we'll have to leave it there. We've been talking with a panel of experts on how the healthcare industry can benefit from improved and methodological information flow. And we've seen how the healthcare industry itself is seeking large-scale transformation, and that improved cross-organizational interactions and collaboration seem to be intrinsic to be able to move forward and capitalize and make that transformation possible. And lastly, we've learned that the Open Group's new Healthcare Industry Forum is doing a lot now and is getting into its full speed to improve the situation. This special BriefingsDirect discussion comes to you in conjunction with the Open Group Conference on February 3rd in San Francisco. It's not too late to register at the Open Group website, and you can also follow the proceedings during and after the conference online and via Twitter. So a big thank you to our panel, Larry Schmidt, the Chief Technologist at HP for the America's Health and life sciences industries, as well as the chairman of the new Open Group Healthcare Industry Forum. Thanks so much, Larry.
You bet. Glad to be here.
And thank you, too, to Eric Stevens, an Oracle Enterprise Architect. We appreciate your time, Eric.
Thanks for having me, Dana.
This is Dana Gardner, Principal Analyst at Interoperability Solutions, your host and moderator for this look at the healthcare ecosystem process. Thanks for listening, and come back next time for more Briefings Direct podcast discussion.